Listen, on Wednesday, March 10, the Most Honorable Andrew Holness, Prime Minister, confirmed it's a second imported case of the coronavirus here in Jamaica. And joining us this morning to discuss the impact of the coronavirus or the COVID-19 on the health sector is Minister of Health, Mr. Moves himself, Christopher Tufton. We also have Dr. Simone Spence, who is Director of Health Promotion and Family Protection, and physician Dr. Orville Nemar. Good morning, everyone, and welcome.
Thank you so much for having us.
Sir, let me start with you, sir. I read yesterday, I heard this morning that there are 5 others that ought to be tested. Where are we with that, sir?
Right, so there are 4 or 5 other persons who are in isolation where samples would have been collected, tested, and untested. Sometime today we should get the results.
Why are they in isolation, sir?
Well, they have displayed symptoms. So the coughing, all the classic or clinical symptoms that would suggest, including travel history, where they were, where they're coming from, because it's all about imported cases or the possibility of imported cases. So by the end of the day, the results should be in, and then we will determine on where to go from there.
Talk to me about travel history, because maybe 3 weeks ago, the only question people were asking were, have you been to China in the last 15 days? But now that's kind of spread to what and what countries?
Right, so it speaks to the rapid rate of spread of the virus.
Right.
In January, it was China. Today, it's nearly 120 countries.
So once you've traveled at all?
Well, we are discouraging non-essential travel. That's part of the overall control. Remember now, the virus spreads primarily through us. We are the vectors. We carry the virus. So it's people-to-people contact. And because of the rapid spread, both to countries and within countries, we determine the riskier countries, which is where we have placed more significant restrictions. And that changes almost every day. And beyond that, we advise persons not to travel at this time unless it is absolutely necessary.
Dr. Spence, there was a concern when they had the first case in California because they said it was airborne. Dr. Tufton just said it's from person to person. So it's not airborne in Jamaica.
No, not airborne at all, based on the evidence that we have currently about COVID-19. It is actually droplet and contact spread, meaning when somebody coughs or sneezes, the virus comes out in droplets. And we have touch surfaces, common surfaces that we touch. We're not cleaning our hands regularly by washing them, etc. And so that close human contact, as well as possibly touching surfaces that may have been infected by COVID-19, is how the virus is transmitted.
You answered the question, but just again, so it cannot be had if it...
No, it's not
right.
in the air.
Right.
Breathing
I can't be
it
just
in.
walking and all of a sudden I feel like I have coronavirus.
No.
Doc, I want to ask you, because Neville raised it this morning.
Sure.
I tried to answer, but I don't think I did effectively. Why not touch the face?
The virus is very specific for lung tissue. So having it on your hand isn't necessarily the problem. It's putting it in an environment where it can get to your lung tissue. So that's where the face becomes a problem. The mucous membranes, that's where it will enter the body.
But the reason we were saying that, because I was suggesting that if it is on my hand, I have it.
No.
So when I touch my face...
No, at that point you don't have the disease. Your hand may be contaminated. But if it is that you now transfer that to where it can get to the lung, at that point you may develop the disease.
So if my hand is contaminated, forgive my ignorance here, why don't I have the disease?
Because it's not affecting the area that the virus is specific for, which is why we say wash hands, wash hands, wash hands. You can prevent it from moving to that point.
Yeah. Dr. Spence, I was also reading that in China they say that they're curing more cases than more people being infected, which would suggest that we're doing something right. How dangerous is this? Because I said this morning that I don't think we should panic. I'm not panicking. I don't think we should panic. But there is panic out there, whether we like it or not. How dangerous is this?
Well, like any new disease, there's often an associated fear because of the fear of the unknown. And we have to acknowledge that. But it does affect, or there's severe disease and severe complication in a certain set of vulnerable persons, which WHO has described as persons older, over the age of 60, and those persons who have comorbid conditions. That is, they have other underlying disease conditions. So diabetes, hypertension, cardiovascular disease, chronic lung disease, and cancer. And so they have a more severe course of the disease. So while it is that we shouldn't be panicking, there is cause for concern, especially in those persons who are most at risk.
Yeah, Doc, you've established response advisory teams. There's a parliamentary committee. Are there any other teams, particularly at the, I would say, parish council community levels that will respond as well?
So the activation of the National Disaster Response Committee, which is chaired by the Prime Minister, encompasses a whole of society approach. So it includes local government, where the Secretariat resides. Of course, Ministry of Health is driving many agencies across the country. So all of government is mobilized in all different shapes and forms to deal with public education, to deal with intervention of one form or another, the constabulary, the JDF. In addition to that, we have been consulting with civil society groups. So this morning I leave here, I'm going to meet with the churches in Kingston. Tomorrow I'm in Montego Bay meeting with other stakeholders. We have met with the private sector groups. And the reason being, the way to control this threat or to minimize the risks is to get everyone to understand what it is, understand the implications for us, and understand what role they need to play.
What about access? I mean, a lot of times when we talk about the capacity to test and the capacity to treat, people feel like it's only in Kingston. I know that throughout the rest of the country we have like type A clinics and so on. Are all of them being equipped or resourced to address this if it does become island-wide?
Right. So we got training from the Pan American Health Organization to test, and we're now testing at the University of the West Indies National Influenza Center. A big part of testing, of course, is training, but another critical part is having the material to train,
Right.
to test. So the reagents, which are not in abundant supply. In fact, countries are lining up waiting. Because it's a new virus, they have to create this and manufacture it. We have enough for now, and we have on order additional supplies, but you would not find that kind of test being administered in multiple facilities.
Yeah. Doc, you wanted to?
Yes. Minister Tufton mentioned that all of government is being mobilized, but I think there's one constituency that still needs to be addressed a little more, engaged more, and that is the family physicians in the private sector. I don't think there's as much linkage as there should be between the ministry and also for some of the information, for details that we need to have for us to be a full part of the response that we have here.
Details like what, Doc?
Let's just say, so when a patient comes into your office, who do you call? Who is your contact person? To whom do you refer this patient? And how do you arrange transport for this individual? Those are just some nitty-gritty details. The ministry's own data says 50% of persons will present to the private sector. And I don't think we have that information to be able to move forward.
Dr. Tufton, I can't remember, it was week before last, we interviewed someone who was in isolation, someone on air. And my last question was, as far as you know, are you the only person in isolation? And the response was the place filling up.
Right.
Was a response. So overall, can you tell us how
So
many?
we have 5 locations currently that have been designated and prepared for quarantine. And don't mix isolation with quarantine.
What's the difference?
Quarantine is observation. So someone who has been at risk because of travel history or otherwise, we place them in a facility and we watch them for 14 days. And then if they develop symptoms, then they go into isolation, which is a more elevated medical...
So isolation meaning you kind of have it.
Isolation means that you display symptoms, you're treated as if you do, until the test results suggest one way or the other. So it's really a hospital setting.
Right.
On the quarantine arrangements, we have had many persons come and go. And
Many?
Yes, I mean, well over 100, I believe. And also... Sorry? Quite a number of persons. So once we introduced the restriction on countries, we had 5 initially, we've added 3 recently. Those Jamaicans coming from those countries are automatically placed in quarantine. Now we have home quarantine, which is a function of what facilities they have, and we assess the risk, or the government institution quarantine, and we have been doing that on an ongoing basis.
So isolation, how many people in isolation?
Since we started, how many?
Currently in isolation now, we'd have the 2 persons who tested positive, plus the 4 or 5 that are currently under investigation or in isolation.
Sorry,
ahead.
we got to wrap up, but I wanted to ask you, Doc, before we go, for persons who are watching and they want to get more information, where do they go? You know, what do
Right.
they-
So reliable sources of information is critically important. So the Ministry of Health and Wellness's website, the Pan American Health Organization, the World Health Organization, or the Center for Disease Control in the U.S. Those are reputable, reliable sources of information, frequently asked questions, what to do with hand hygiene, cough etiquette. All the information is there for you.
Can I just respond that I take note of the concern you have raised, and I will talk after. But I know there is a program to reach out to the private doctors. So if there are any hiccups there, we'll certainly address it.
Dr. Nemard, when do they see you? A cough, could have flu, could have dengue, could have, how I know, and when do I see you? When do I say, no, I don't
This
like
is
all
another
that?
aspect of some of the messaging which needs to change, because we've been talking about patients going in, once they feel ill. With an outbreak of corona, we don't want that. Most persons are going to be able to recover on their own at home. And by simply coming into a center, all they're doing is potentially infecting the caregiver.
So when do I see the doctor?
When it is that if your fever isn't settling down, if you're getting short of breath, if your illness is not resolving in a 4 or 5 day sort of period.
Yeah.
We have, however, promoted the toll-free, the line, and we will do more of that, because what we've actually said is that persons who may discern some sort of concern, they should actually call. And in fact, we do prefer them to call so that we can provide guidance rather than a rush
Go in.
on facilities, which just creates more panic.
And calling their your medical center as well, so that they can prepare for your visit, and if it is that you need to be masked coming in, that we can do so.
Dr. Simone, I ask this question very seriously. I'm over 60 years old. Is it a death sentence if someone gets it in Jamaica and you said vulnerable? Does that mean they won't be cured?
No, it doesn't mean that. It just means that for some persons, yes, age is one factor, as we said, comorbid conditions. But if your comorbid condition is well managed and you're healthy overall, then you're less likely to have a severe course of the disease. So no, it is not a death sentence. It just means that you are at greater risk.
Okay. What about the youngsters?
The youngsters, at this point in time, the evidence is not pointing to much severe disease in the young, the very young, even though they can have it, but they're not the most.
Where youngsters we have to be careful is that they are major transmitters of the virus. They're very active, they're all over the place, they touch everything. So part of the concerns around schools or other public gatherings for that matter, which we have announced some restrictions last evening, is that the person-to-person contact increases significantly the risk of spread.
Dr. Simone, back to you. Does that mean, from what you said, that more than likely the majority of the folks who get it will be safe?
Yes, they will have mild disease, the vast majority.
Yeah. Dr. Tufton, what about, because you called off champs, I'm going to say you, I mean, yeah. when I say you, no man. Well, actually I thought, I didn't think you guys had a choice.
It's a difficult
But what
choice.
about like our prisons, the Golden Age homes, what about those areas?
The truth is that the more the virus becomes a threat internally, and in particular, once you start having, hopefully not, but community spread, we have had 2 imported cases. Once you start to spread internally, the restrictions on public gatherings will increase. The Prime Minister spoke yesterday in a press briefing that not only champs, but there's a restriction now on issuing new permits for activities and revoking permits that have been issued over for the next 2 weeks. And that is going to give us an opportunity to assess, because remember now, the 2 that have been confirmed came in contact with a number of persons in their normal
Have you
moving.
found all those people?
We have found most, I think, based on the interrogation, but you continue to provide
And they were
advisories.
quarantined? Sorry to jump
They
in.
have been quarantined, yes. I
Okay.
think for the first person, about 15 or so persons have been quarantined, and then others for the other. So the challenge with an imported case is that it becomes very easy to move to a local.
Right.
And we come in contact with a lot of persons, and it multiplies. So not only are we quarantining the 15, but those 15 would have come in contact with others.
Right.
And so if one of that 15 start developing symptoms, then we have to trace down the persons that they were in contact with, and it just expands. So the
Has
public
that-
gathering is very key.
Yeah, how has that impacted the protocol at our airports and so on? When people come in, are we a little bit more strict in finding out their travel history and so
Very,
on?
very, very strict in that. I mean, I think the public health team have done a very good job working with PICA, the immigration authorities. Once we have placed a country on a particular watch, those persons are either, if it's heightened restriction, they are turned around. We've actually sent back a number of persons who came in on that list. And for the Jamaicans or others, we have to ask a lot of questions.
Yeah. I'm impressed with your work, sir. I congratulate you. But my final question is, do we have the resources that, for whatever reason, this gets out of hand, which is my words, do we have the resources?
So the government has committed the resources that we need at this point in time, with the promise to commit more if necessary. It's an important issue, and the government takes it very, very seriously. As I said, it's not a death sentence. We're trying to discourage panic, but we want the country to be aware and concerned. It has the potential to create significant downtime, persons who are ill, because we say to Jamaicans, if you are sick, stay home. So it has implications for productivity, for work. Of course, it has the extreme implications that could, as a result of the vulnerable groups. And, it is obvious that it is putting the world in a state of panic. I mean, if you observe in other countries, in New York, an entire city has been under lockdown with the National Guard. Italy. Yeah. The Trump administration just announced travel restrictions on all countries in Europe, except the UK, going into the Now that for the airline industry, for tourism.
Yeah.
So there is a heightened awareness and out of the concern. It will run its course. It's not the end of the world, and that's very important to transmit. Yeah. So it will go up, go down like any other. What we have to do is minimize the exposure.
Yeah. Ever seen anything like this, Doc?
No. Closest might have been H1N1, but this is just totally new.
Thanks for coming.
Thank you so much for having us.
God bless you, sir. Dr. Christopher Tufton, the Honorable Minister of Health, Dr. Simone Spence, Director of Health Promotion and Protection, and the Family Physician, Dr. Orbin Gabbard, who will soon be my co-host. He's been here enough times.
No, give up your job. See, he'll be my co-host. Don't try to fire nobody on the show. Coming up, we hear the inspirational story about Brenda Taylor raising a blind daughter. We'll be right back.
He'll be my co-host.